Hi, everyone, and welcome to another Patient Spotlight episode brought to you by Aila Health. I am here today with Dr. Arielle Dance. She lives in Maplewood, New Jersey with her wife and her chihuahua-terrier. She is a writer of children's books, disability visibility articles, and topics that touch the soul. Dr. Dance has been published in online blogs, magazines, and most recently, the Harvard Business Review. She is a passionate team member of the health equity team at the American Cancer Society, where she's worked since 2012. Arielle also serves as an ambassador for World Thrombosis Day, fearlessly sharing her blood clot survivorship journey. And she's an advocate and researcher in the endometriosis arena. Within this community, Arielle is also actively involved in numerous initiatives with the North Jersey Alumni chapter of Delta Sigma Theta Sorority, including co-chairing the Physical and Mental Health Committee. And it's so wonderful to have you here with us, Arielle. Welcome.
Thanks. Thank you so much. I'm so excited to be here.
So maybe to begin with, you have a history of endometriosis. And I'm wondering, just to start, can you let some people who maybe don't know what endometriosis is and how it can affect someone?
Yes. So people who have endometriosis, it used to be known as a women's health disease. We try not to do that anymore. We say people who have endometriosis, who have a uterus, who have ovaries, may experience painful periods, pain between periods, and it happens when implants or scar tissue, tissue similar to the lining of the uterus, the endometrium, is found outside of where it's supposed to be. So it can be found on the rectum. It can be found near the ovaries, on the fallopian tubes. It's been found in a number of places. It can even cause collapsed lungs sometimes. So it's just very painful. I think that's the only way to really explain it. It's painful, and most believe, and I do believe, it's incurable. Some people believe they can cure it with their diet, and but I don't believe that that's necessarily true. I think you can tame and manage pain through some things, but it is not curable. Even with hysterectomy, it's not curable. It is chronic pain. And I know we can talk about chronic pain, of course, as we go on, but it's painful, and it's not just bad periods. A lot of people believe it's a bad period. It's not just a bad period. It can happen between periods. You can just be in pain, headaches, vomiting, leg cramping, exhaustion, fatigue. I mean, it's pretty much a full body illness.
Yeah, so there's a lot that gets wrapped up in, this one word, that's endometriosis.
Yeah.
What has your experience been like with this over the years?
Sure. So I was diagnosed at 15. Luckily, my mother was a big advocate for me. So my diagnosis at 15 was rare. A lot of people have delayed diagnosis, sometimes 20 years. So they may not be diagnosed until they're adults. But luckily, my mom took me to the gynecologist after my pediatrician thought it was a stomach virus. And my mother, you can only be diagnosed completely with surgery. So you have to have a laparoscopy for them to see inside and actually do some pathology, say, yes, this tissue is diseased. And so my mom advocated for me and said, no, I need you to look, I need you to see. And I'm grateful for that, because before that, it was just a lot of periods, and a lot of periods with me passing out, periods with me vomiting. And I mean, that didn't stop necessarily, but we had an answer and we had a name. And so that was really important. And, even still now, in my 30s, I'm still experiencing really painful periods. I'm exhausted. Most days my energy is not great, and leg cramping, digestive issues. So some GI issues are kind of the domino effect for me. I've had I don't even know. It's hard to tell, and with autoimmune, with anything autoimmune related, what's connected. So I've had allergies and asthma that have sprung up in my adult life. I've had some rheumatoid factor autoimmune things that have sprung up in my adult life. And because I was on birth control for the endometriosis, I ended up getting blood clots. And you kind of mentioned that in my bio, but I had blood clots 2 times and I was in the ICU twice for that as well. So my life kind of, unfortunately, kind of surrounded my health, but I decided to kind of flip it around and kind of advocate for those things. And a lot of people you'll find in our community of endometriosis, we are big advocates because we want people to know, 1 in 10 people will have endometriosis. Like, we are out there. It's not a secret. We're there. We're walking around with you, So yeah.
So there's a lot there, and it sounds like it's been an ongoing and learning process for you, and really understanding how to treat your endo and also manage it. So manage it as well as all of the other things that come along with it and kind of offshoot from that. So can you just give us an idea or a sense of some of the things that you've done to help manage your condition?
Oh, for sure. So in the early stages of my diagnosis, I was very reliant on pharmaceuticals. And that's because endometriosis is traditionally treated with hormones. So birth control, I mentioned. Lupron is a very big pharmaceutical. It's an injection, which we now know. I say we because I just learned this in the past couple years. Lupron is actually linked as a chemo drug, but I didn't know that it was linked as a chemo drug, and I had it. I was getting Lupron injections at 16 and 19. It suppresses ovulation, suppresses your period, and puts you into menopause, essentially. And the thought is that that's good, right? No ovulation, no periods, less pain. Yeah. But the side effects of that medication are so traumatic on the body. And just picturing a 16-year-old going through menopause, it was traumatic. Yes, it was traumatic. And it wasn't a great experience at all. And so I dealt with that. And then, as I mentioned, once the birth control kind of triggered a blood clot for me, I had to stop hormones altogether. And I stopped pain medicine altogether. And at the same time, I was actually going through a PhD program where, you and I actually connected, that focused in mind-body medicine. And so I was learning some tools that I could use on myself. And I really just focused on how I could heal myself, is the best way to put it. How could I work with guided imagery and breathing exercises, and even just, I think the most simple thing is I was practicing Reiki a lot, even before I had gotten into this PhD program. And the feeling of just putting warm hands on myself and taking deep breaths is the most healing thing I can experience. And so simple acts like that are soothing for me. And also, I just love a good dance party. My last name is Dance. I dance all the time. It hurts sometimes, so I've learned to just dance from the places that don't hurt. And sometimes that's just in a seat and just dancing with your arms. But if I can full body dance it out, that's just a release, and also just bringing in some good energy for me. So I had to learn how to, heal from other places without medication.
Yeah, and interesting about the dance part of it too, right? We know from an evidence base and the research, suggests that, dance and movement can be very healing in that way with pain. But how do you manage, of course, if you're feeling a lot of pain, you don't want to dance, you don't want to dance, you don't want to move your body, although that can kind of help you work through some of the pain. So what did you do with that? How did you, listen to your body and respond?
Yeah. So it's really about, for me, sometimes it's a long stretch, right? And I mean, I have to do it like just a long stretch. It can be really slow, but like that's also like stretching this pain out, but also like maybe that long stretch like takes me into a movement, and then I'm moving and I'm dancing, and before I know it, it's fully moving and I'm fully dancing and I'm doing something, and then I'm like, okay, you're moving, you've got this, you're fine. And then maybe in the end, I'm just sitting on my floor with my legs crisscross applesauce, and like all I'm doing is just rolling my neck. All I'm doing is just rolling my shoulders because that's all I have the energy for. Or maybe like the only things that don't hurt are my wrists that day. And so I'm just doing a whole lot of, I'm grateful. I'm grateful. I'm grateful. And like maybe that's all you have the energy for. And so I always say dance from a place of pain or dance from a place that doesn't hurt, because I used to teach movement. I did a lot of movement workshops in the past when I was a grad student, and I had one of my, I wouldn't call her a student because she wasn't a student. She was someone in these workshops with me, and she was in a wheelchair. She was an amputee, and she had the brightest spirit. And you knew she was having the best day when she would get up on her one leg that wasn't amputated, and she would stand up out of her wheelchair. And like, that's when she was having her bright days, she would say. But on her bad days, you would see she wouldn't get out of her wheelchair. And so like, she would inspire me. And I used to tell myself, like, there's no way. And I never like to compare disability to disability or ailment to ailment, but like, she inspired the heck out of me. And so I was like, if she can fully get up out of her wheelchair today, I can dance from my painful places today too. So we inspired each other. We all were inspiring each other in that workshop. So yeah, I can go on and on about movement. Another woman had MS, and she would lead our workshops, and she just, I mean, you would never know. She would lead these beautiful African dance workshops, and then at the end she'd say, okay, my MS is flaring, we've got to go. And she would just say, and you would never know until she like disclosed. Like, you never know what someone is going through. And I think that's just the beauty of this world of chronic pain and chronic illness and disability, visibility, is that you just never know what someone's walk is. And I think that's a lot about invisible illness sometimes, is that we're wearing like this mask and we feel like we have to, you know, hide behind it. But if we just peel it back and show you who we are, then you're like, oh, I can relate to that. I see you.
And what are some ways that you do that? You know, that moving through invisible disability, and, you know, peeling back that mask, right? Because, you know, when we're out in the world and it's like, okay, this person doesn't know really the struggle that I'm facing inside, you know, what are some of the ways that you work with that?
I feel like I try to be as vulnerable and honest as possible, honestly, because for the situations that I have been through, I think awareness is key. And I think that because I am a young person, I consider myself young, and I have to remember I'm not as young as I thought I was, but I think I could still consider myself young. I think there's this idea sometimes that young people have that we are invincible. And so I go out of my way to remind my peers we are not, and that we have to take care of ourselves and we have to be mindful of our health. So, I mean, in terms of like, let's say in terms of my blood clot story and my pulmonary embolism journey, I am very verbal and very outspoken and very much an advocate in terms of just telling people. If someone says I'm flying to such and such a place, I'm like, okay, great. Stretch your legs, take breaks, go to the bathroom, stand up every 30 minutes to an hour. Like, don't sleep if it's a red eye. Like, I'm telling everyone. And I'm like, someone says, oh, I've been on birth control for 15 years. I'm like, okay, well, talk to your doctor because I was on birth control for 10 years. And, you know, like, you have to just tell people. And I don't think there should be any shame from my perspective about what I've gone through. Now, that's not to say that anyone else has to be outspoken and telling their story all the time. That's not everyone's journey. I recognize that. But for me, if I can save one life from getting a blood clot, I think I've done it. And I've had people come to me when they did get a blood clot, and they're like, thank you. Because of you, I knew to go to the hospital when I felt this pain. Because of you, I knew that this wasn't right when they sent me home from the hospital, right? Because people have gone to the hospital, said they had these ailments, knew it was a blood clot, got sent home. And they were like, I knew because of you, that wasn't right. So they'll come back to me and they're like, thank you for, equipping me with that knowledge, for giving me that information. So I think that there's something to be said about me not wearing a mask all the time, me not pretending I'm okay all the time. People need to know what's really going on with you sometimes, because, you're empowering other people to take control and take back their health. So I don't know if that's a right or wrong way to walk through the path, but that's what I have to do.
Wow. And I don't know if there is a right or a wrong way to walk through the path, right? Like, this is your journey, and it's not, it won't be the same for someone else, right? But, and how incredible, I think of this concept of the wounded healer, right? That, coming through, using your own experience, like as traumatic, as, awful and painful and all of what it was, to move through that and go, okay, now here I'm going to be informing and educating and, uplifting others, because if you can change one life, right, which we'll never know for sure, but you surely must have, that person who said, oh, I knew I had a blood clot and I could get medical, have a medical intervention to save their life. It's incredible.
Yeah, I hope so. I sure hope so.
Yeah. So, you mentioned, at the beginning of this, about chronic pain, and maybe you can speak to that a little bit further in terms of just, what that means, what that means for you, how, how that, is underlying or overlaying, your life and day in and day out and in your condition.
Yeah. So I think of it like this. I don't know if you're familiar with the spoon theory.
Yeah, please tell us more about that.
Okay, so I may mess it up, and I should have probably had a reference. So I would say Google the spoon theory. It's real. But it's pretty much to say that we start our day with a bunch of spoons. You're allotted a certain amount of energy in a day. If you live with disability, if you live with chronic illness, you live with chronic pain, we are allotted this much energy, this many spoons. And then to do everything throughout your day takes a spoon from you, takes this ounce of energy. And it's everything from opening your eyes, rolling over, putting your legs on the edge of the bed, brushing your hair, getting to the shower, brushing your teeth, every little thing. And by then we've already used up 10 spoons, and I haven't even made it downstairs to start my work day, right? You haven't even, if you have to get to work, now luckily we're still working from home. So like, thank goodness I'm still home. That's the best blessing for me right now with my health. Being able to like move to the couch on a bad day, love it. Being able to put a heating pad or an ice pack on something when it hurts on the couch, blessing. Being able to wear sweatpants during the day now, a blessing, because it was a struggle when you'd have to like, I've had days when I used to drive to work and would pull over on the highway, vomit, and still have to get home. And so, and there was no period. It was just a Tuesday. So like, with knowing that like I can do my job from home and be more comfortable, but like when I wake up now, it's like I take inventory of my body. And I think doing a body scan in the morning is really helpful for me. I say like, okay, how's your head feeling? Like right now I know, okay, I got a headache. That's okay. Okay, how are your joints? I'm like, okay, left hand stiff, achy. Okay. Hips, okay. Pelvis, little stiff, sharp on the left. Okay. Joints, okay. And then I roll over and get out of bed, because that lets me know how many spoons I need to exert to get through my morning? And where do I need to like adjust? Like I do a body scan first because it kind of lets me know how I'm going to move through the rest of my day. And then I started icing. I started going to the chiropractor recently, and they suggested that like icing some of these inflamed areas would be really helpful for me. And it's made a world of difference. I didn't even realize that ice was like the key. Everyone thinks you need a heating pad for everything. Ice was the key for me. So I don't know. For me, I just live in this painful state every day. But someone said, when was the last time you weren't in pain? 14? I don't know. I'm so used to it. I have no idea. It's so tough to answer a question like that. I don't know.
Yeah. And, it's interesting, what you're saying too about the work from home situation has completely changed your life. And, that just, makes me think of these ways that we can advocate for ourselves in the workplace to arrive at a place where we can receive accommodations, when we need them. Can you offer, thoughts about that? And just, I know that's a real struggle that people deal with if they're having to physically go into a workplace, or even if they're working from home and still feeling hours are, whatever, it's not quite working for them in whatever capacity.
It's true. And I recognize, it's definitely a privilege to have and a luxury to be able to work from home. I know everyone's jobs do not allow for that. But I think, I think back to college where there was definitely an opportunity to disclose to like health services what you're going through. So I used health services a lot when I was in college, disability services, and I would go and I'd say, I need accommodations. I cannot walk fast enough to get to this building, between these buildings. I need a room because all of our dorm buildings didn't have air conditioning. And I was like, I cannot sleep in a building that does not have air conditioning. And that was health related, right? And so, being able to voice those things. But again, it's about disclosing, and it's like your level of comfort disclosing that. But as an adult, now we're in workplaces. Do you want to tell your supervisor all the time? Every supervisor, and I know I've changed bosses several times at my company. Do you want to tell every supervisor your medical information? Maybe not. But if you're comfortable, I think it's okay to disclose and say, this is what I'm going through. And then also know your rights through the ADA, the American, let me get it right, the Disabilities Act, and know that you have rights and you should be accommodated in some aspects. And so if your supervisor is willing, and I've had some that were willing to say, okay, then you can work from home.
Oh, I don't know if it's me, Arielle, but I just lost let's see. I just lost you there for a second.
I'm here.
Oh, now I can hear you again. I'm not sure if it was me or you. Okay, I'm sorry. Please continue.
It's okay. So I think it's just really important for us to be able to, feel that we're comfortable disclosing. And if you have a supervisor who is, willing to make those accommodations for you, maybe they will say you can work from home 2 out of 5 days a week, or even when you need to, right? When it's necessary, when you're having rough days, when you're having a flare, when you have appointments that are really far away, things like that. And hopefully you have someone who's really accommodating. But if you're having someone who's challenging, you should be able to, go to HR or something like that to get support as well. But it's tough if you always feel like you have to disclose.
Yeah, imagine there's a balance there between, how much do I share? How much do I withhold? What have you found to be helpful in that, finding that balance of like, okay, what is, how much of this do I need to bring in and what do I need to hold back?
Yeah. I've found that I don't always disclose right away. I definitely feel my supervisors out first. But I remember, for example, having a really, really tough day. This was around the time where I was on the side of the road vomiting on the highway. And I had to tell my supervisor what was going on. And she is not in the same state as me. I'm in New Jersey, she's in Massachusetts. And I eventually, disclosed to her what was happening because she was worried. She was like, I can't have you on the highway throwing up and I can't get to you. She was just so worried. And so I disclosed. I told her, I have endometriosis. This is what's going on. And you know what happened? She has endometriosis. It was just like, oh, of course you do. Like, of course, I was so scared to share this piece of myself. And I ended up finding someone who was so compassionate and so understanding. And she was the first supervisor I think I had who was like, if you need to work from home, work from home. But that's because she got it, right? I don't know if I would have been so, lucky to find that.
And there's there's not some, but maybe a lot of courage that comes with that. It's because you will never know unless you do speak up and, ask for things that you need or, share personal information because you might not have ever known otherwise. If you did. But it could have gone the other way that,
it could have gone anyway.
It could have gone anyway, but you would have never known until you said something.
Yeah.
So, and you had mentioned, a moment ago about kind of managing a flare and coping with a flare. And I know you've spoken to a bit, some of these self-care practices that you have, but can you maybe share a little bit more about what you do when you what a flare looks like for you and what you do to get through it or to manage?
I don't even know how to explain it. It's really tough. I just don't even know how to put it into words. Sometimes I wish I could let people feel it, but I would never want anyone to feel it. When I was younger, I used to say to other people who have periods, imagine your worst period and multiply it times 10. But I don't think that's the feeling because it's not a cramping feeling. If anyone's listening and you've had a period, it's not a cramping feeling for me. It's like a sharp, dull, stabbing feeling that wraps around to my lower back, goes down, radiates into my legs. I'm nauseous and I have a migraine. So all those things at the same time. And then I can't lay down, but I can't sit up, but I can't walk around. And I'm hungry, but I don't want to eat because I'm nauseated. And then, so heating pads sometimes work, but maybe ice will work better this next go round. CBD works. A lot of lavender oil really works. I'm trying to think. I do a lot of guided imagery. I think I mentioned that before. Guided imagery works best during a flare. I don't use it as much during my period. And this is more so something I ended up creating a guided imagery specifically for pelvic pain or chronic pain.
And I was going to ask you, if you have a resource that you like to use or you created your own.
I did. When I was in grad school, I created a guided imagery specifically for chronic pelvic pain. And so it works wonders for me. It worked for the people who used it. If anything, it'll put you to sleep. And that's good enough for me. It definitely relaxes me. And so I enjoy it for sure. So that's helpful for me as well. And then, I think those are kind of like my go-tos, but honestly, you just kind of have to ride it out.
And it sounds like find what works for you because
everyone's process is different for sure. But I think I mentioned this, and I'm sorry if I'm repeating, but I did just start the chiropractor, but I only started within the past month. So trying to see if some of these adjustments will work for me because I didn't think that my body was as out of alignment as it was, but when I saw like x-rays, even I have like curves I didn't know I have. And I was like, oh, and when we broke it down, I was like, that explains a lot of like the pelvic things that are going on. So
It's a whole body
It's a whole body experience.
situation here.
I said that, right? It's a full body, head to toe.
Full body, the mind, the body, all of it.
Mm-hmm.
And just in our remaining minutes here, Arielle, do you have any last recommendations for people who might be feeling like their endo battle is just overwhelming?
I will say my journey is not going to be your journey, and all the journeys that you read about on the internet will not be your journey. We all will walk through it differently, but we are here to support each other. Stay encouraged. Find a specialist, a doctor, a medical provider who can help you. Something that I've learned is that every medical provider is not a specialist in endometriosis. And I don't know if I can say this, so feel free to cut this out if it's not okay. But there is specialized endometriosis surgery, and every gynecologist isn't trained to do it. They don't spend a lot of time learning about endometriosis. If you ask a medical student how much time they spent learning about endometriosis, it's not very long. It's not a significant amount of time. And so there are people who do extended education just on this disease, on endometriosis and adenomyosis, which is like the sister cousin disease. And so I would say try to talk to these people, and then find a care team, not just the gynecologist, but also, maybe a pelvic floor therapist, maybe a therapist, someone to talk to, maybe a chiropractor, an acupuncturist. Like, you want a full body care team who will take care of you, because we got a lot going on and we need to take care of ourselves. And so, be good to yourself and be gentle with yourself and be patient. It's a process.
That's so beautiful and wonderful recommendations. And thank you so much, Dr. Dance, for being here and dancing with us a little bit.
I'm sorry, I probably looked nuts.
As we move, I love it. It's a reminder to listen to the body and to move the body. And thank you so much for your time and being here and sharing your insight and your story with us.
Thank you so much, Shannon. It means so much.